Plastic and reconstructive surgery is no longer just about appearance. It's playing a vital role in restoring confidence, function, and also quality of life. With rapid medical advancements and growing public interest, understanding the science, responsibility, and ethics behind these procedures has never been more important. Today, we are pleased to have with us today Dr. Adel Quttainah. He's a consultant plastic and reconstructive surgeon to share his expert insight on his evolving world of plastic surgery, patient safety, and the balance between medical necessity and aesthetic excellence. So hello and good morning, Doctor.
Good morning, sir. How are you?
We are fine. We are so pleased to have you in Good Morning Kuwait, Doctor.
Thanks for having me.
Well, Doctor, you are really well-known consultant and a plastic and reconstructive surgeon. Some people really misunderstood between both of them. So we'd like from you, from your perspective, why do people confuse?
I mean, plastic and reconstructive is like basically a specialty that was born based on the need of reconstructing defects, like burns, tumors, congenital defects and all that. The plastics word means to remold or give shape to. So when you lose a part of your body, you try and make that, try to rebuild that body part.
Yeah.
The aesthetic part is a different thing. The aesthetic part is the cosmetic surgery and all this. So plastic and reconstructive, it's a huge specialty that encompasses both sections, So yeah.
So this is the differences between plastic and reconstructive surgery.
I mean, basically you get the training for both. Well, if you go to a properly structured training program, you get structured for both reconstructive. Actually, plastic and reconstructive is the same thing.
Yeah.
But the aesthetic part is where it's a subspecialty of that also. So
yeah. So Dr. Adel, we say that as a consultant, both plastic and reconstructive, as we mentioned, and also we would like to know the medical necessity and the aesthetic, let's say, surgery. Would like to know, let's say, what is the difference between them?
Medical, I think what you mean by medical necessity is the functionality, and the aesthetics is, I mean, they go hand in hand. Okay. Basically, whenever we do an aesthetic procedure, we have to form function. Form follows function. So function has to be, it's like when we're doing a rhinoplasty, a nose job. We can't just go and fix the nose. We have to make sure also that the breathing is fine. Okay. The breathing is okay. That's just a small example of where the medical necessity dictates what we can do aesthetically.
Okay. So Dr. Adel, some people really wants to know before having or deciding to have a plastic surgery, whether anywhere in their body, would they want to know the safety? The procedure for the safety first. We'd like to know more about that.
I mean, it's well known that aesthetic plastic surgery is the safest surgeries out there, especially liposuction. A lot of people think that, liposuction is dangerous and all that kind of stuff. No, it's the safest procedure that's performed nowadays, and it's performed in the millions. Of course, I mean, we are dealing with healthy patients, patients that don't have real medical issues, and safety is paramount. It's the first thing, before we indulge in any kind of aesthetic procedure. So it goes hand in hand.
It goes hand in hand.
We deal with healthy patients. We just make them healthy and beautiful.
Okay, so, what procedure they should consider for the patients before having this?
I mean, of course, I mean, it depends. Most of our patients are younger patients. When we deal with older patients, they go through the whole array of tests. When they see the anesthetist, if they're going to go under GA or anything, we have to make sure that their heart's functioning fine, everything's fine, the bloods are fine, and they will withstand GA, general anesthetic. And of course, whatever we do, we don't destroy function. Okay. So safety is
Safety is first.
Yeah, always.
Always.
Yeah, always.
So, Dr. Adel, we know that some people really have a huge demand on plastic surgery nowadays in recent years. We'd like to know from your point of view, why is that? Is it because of the social media, let's say?
I mean, social definitely plays a huge part in putting our services out there. Yeah. Showing different trends all over the world, showing what, I mean, it's a good thing and it's a bad thing, huh? But generally, it helps all these platforms on all these streams. They educate people, They tell people, unfortunately, it's telling people what they should look like also.
Yeah.
And so that's pushed our industry a lot in the in the last few years. Also, there's a general, people nowadays are, in their 50s, they look like they're in their 40s, yeah?
Yeah.
And they want to hold on to that youth, and they want to hold on. I mean, you feel young inside, but your body is telling you otherwise or showing otherwise. So they try and change things to kind of match that energy they have inside,
Yeah.
So
we can see, like in the social media,
Yeah.
celebrities like in 90s,
Yeah.
when they are in the 40s, they look like in the 50s or
Exactly,
60s. But
absolutely,
nowadays,
absolutely.
they look as they are 30 or 20s.
Yeah.
That's really a difference between generations. As you mentioned, Doctor, is really a really good point about some people, they feel youth and young in their soul and their heart, but in the
And
shape
they want that
feel
to reflect also.
to reflect. That's
Yeah,
really
yeah.
important to have the really quality of life, enhance
True,
the
true.
quality of life.
Yeah.
So there are some increasing in discussion about the ethical, let's say, responsibility in cosmetic, surgery
Yeah.
for the doctors.
I mean, it's just not for cosmetic surgery, it's for all branches of medicine. I mean,
Exactly.
ethics comes first, You're dealing with patients, they're trusting you with their lives, they're trusting you with your decisions. So there's has to be some sense of responsibility and ethics in deciding what treatment they should go through. And unfortunately, there's always bad apples, people that push treatments just to kind of, financial gains. But in general, we would like to think that we are ethical.
Yeah.
And if a patient does not need a procedure, we tell him, you know what, sorry, I can't help you. This is not for you. Rather than just absorbing that and
that's very important actually to
So
say no to a patient.
Absolutely.
Actually, especially the
yeah.
teenaged or young, they want
Absolutely.
fillers or whatever.
There's many examples where you just say no, and it's I mean, it's not only for the patient's good, it's also for doctors' sake, because if he deals with a patient that's has high expectations or unrealistic expectations, they'll come back to haunt him, and the patient will never be happy, and it's just a mess. So,
a mess for both the doctor and the patient. Okay.
Yeah.
So let's talk about the rapid increasing of the technology, like 3D imaging. How actually can really help for outcomes for the plastic surgery outcomes?
I mean, this is, especially with AI coming on strong like this, we are getting, patients are kind of seeing what results they can expect after the surgery. That, I mean, we're still early to say, especially in the field of aesthetic surgery, how AI is going to contribute to all that. But the imaging is there. It's just kind of a rough template to show the patient what they might look like after the surgery.
Yeah.
So, but it's not necessarily what they will get. So all depends on how good the doctor is and how honest the doctor is in telling the patients, you know what, this is a bit unrealistic. You're not going to get this picture. Because we get a lot of patients coming in with pictures and AI-generated, renditions of how they're going to look like post-op and all that, and sometimes
don't trust actually the
yeah, I mean, it depends. Every patient's different, huh?
difference.
The structure's different, so.
Yeah, so people really rely on, let's say, for example, the simplest thing, the Photoshop for the nose job.
Yeah,
they say, I want exactly what it happened in the Photoshop, but the result is really different and maybe better than the Photoshop, isn't it?
Yeah, true. I mean, again, it depends on how good the surgeon is and telling them, you know what, you'll get this, but you won't get this, and so.
Exactly. So
it
some people
help.
really seek for the natural look, let's say, look.
Yeah.
So what's your point of look, point of opinion?
I think we are kind of heading back towards making our patients look more natural. We're heading back to becoming less invasive.
Yeah.
We're heading back to having patients do surgeries and not have a really long recovery time. So these are the things that we actually are getting better at. At the end of the day, you don't want your patients to look weird or overdone or operated on. So it's always, especially with facelifts now. It's a good example about facelifts. In the past, patients used to hate looking at facelift results because it was mostly skin, and the patients looked weird. Okay, they looked a bit taut, but they looked weird. With our techniques now, the deep plane facelifts and all that, they're looking natural.
Yeah.
and the scars are less, and so we're seeing a huge comeback now for patients. I mean, almost like 60% of my patients are facelift patients now because they've seen the results. It's you, but 10 years younger, more natural, refreshed.
Okay, and refreshed because of that.
Yeah.
So looking for the innovations in trend, do you believe it will shape the future in plastic surgery?
I mean, you know, we're one of those specialties that are very, we don't evolve that much.
Yeah.
Because a lot of other specialties depends on robots and all that kind of stuff. Our specialty really depends on, you know, art refinements and it's a bit more, you know, complicated than you know, having machines do your work and stuff like that. I think, like I said, our future is in making patients look more natural and not doing too much for them, not being too invasive. You know, preserving function, making them not only look better but also feel better.
And feel better as well.
Yeah.
So any, let's say, revealing some secrets for our dear viewers about the new trends for what are they doing the celebrations now? The celebrities, let's say. Some
celebrities are actually cashing in on what I just said. You know, like Kylie Jenner. You know, everybody's loving the way she looks. I mean, yeah, but she did the deep plane facelift. She lost weight. She did a skincare regimen. So it's a combination of things, you know. And like even with her, a facelift is not just a facelift. You got to look at the brows. You got to look at the nose. You got to look at the lips. The fat.
The neck, actually,
everything.
as well.
Yeah, you gotta. You know, you have to. Every patient's different. So you know.
So do you have any advice for our dear viewers, doctor, considering to have or are thinking to have some plastic surgery or reconstructive surgery? Yeah,
absolutely. Like, I mean, like I've always said, you know, do not follow whatever you see out there on the streaming platforms and on social media, whatever platform it is. You know, nowadays, unfortunately, it's like whoever kind of spends more money on their social media gets more patients. You know, okay, fine. That could be a way of you knowing that there's a surgeon out there, but you start asking, see the patients that he's done. What is his qualifications? Is he just, you know, just because he's good in rhinoplasty, doesn't know, maybe he doesn't know how to do body contouring, you know? So always ask these questions. Check the facility out, you know, because the surgeon might be good, that the place that you do the surgery in might be not so good, you know. Check the anesthetist, the post-op care is also important, and the follow-up is important. So you got to do a lot of research before you actually choose a doctor. And one really good advice, don't go see one doctor only. See like 3 top doctors in your country and see how the treatment plans compare. And then, you know, and keep on asking. Don't just, well, I'm going to do a facelift and do it next week. No, just spend 3-4 months researching, asking, till you're confident. And even ask your surgeon, can I talk to patients that you've operated on before? That is the best thing, you know. I get a lot of my patients asking me, and then of course, and my patients are happy, they're willing to share this with other people, with other new patients that are coming. Just to tell them about the process, what they went through, and all that, you know. So
that's amazing.
That's the best advice I can give.
Well, really, it's really a great advice you provide us, Dr. Adel. It's really great interview, and also for sure, your patients are really happy with your results. Thank you so much, doctor.
Thank you. Thanks.
Big thanks and appreciation to our dear guest, Dr. Adel Quttainah, consultant plastic and reconstructive surgeon. So don't go away to review us. Let's have the sanitary break, and then we'll move on.